Phil is a interesting guy. He has an astonishing range of interest.
Well, I think he's surprisingly quiet and shy, not what most people would think about him.
And it may be that not enough people do understand how much he loves Hawaii and the opportunity to really get away from it all once in a while and spend time with his bride and with his family.
So my experience of Phil outside of the realm of the healthcare industry was to observe him as the most loving family member, father, husband, grandfather that I'd ever seen.
He's a shell collector. You can go into his house and he has just drawers and drawers of beautiful shells from all over the country.
And the other was, I just remember so many times you go into his office and one, you might have to sit on the other side of the fish tank and sort of stare through the fish tank to talk through him. Or at other times put his little giraffe next to you, so it was this kind of game. So there was always the animal side to it.
The giraffe became Phil's icon, symbolizing his stick-your-neck-out-to-succeed approach to life. The giraffe first came into view some 30 years ago.
I first met Phil Noodleman in April of 1972. He was at Lake Hills Pharmacy then, and I had just become the director of Heads Up Center in Bellevue, Washington. And people assumed that pharmacists would know about all kinds of drugs, including illegal drugs, and it so happened actually that he did, because he was a very bright mind and very curious about a lot of things and had done a lot of study. And so he emerged as sort of as a community resource that, in fact, a whole organization that's now 3 years old was built around volunteer power, and Phil was really the first volunteer.
The first, but certainly not his last volunteer effort. In 1973, Phil took a job with Group Health, where he soon attracted attention.
I have a fuzzy memory of a meeting in early 1970s when I was on the board, and I came home one night and told my wife, there are a couple new young guys who are rising in management in Group Health. They're going to be in good hands. One was Phil and the other was Grant McLaughlin. One of the things that Phil had done is to develop what really was a world-class pharmacy system, not only in terms of its structure, but in terms of its use computerized information from it.
It was a bold step that would change the industry. To explain how this revolutionary system worked, Phil the pharmacist went on camera to compare old methods to new. Fortunately for Group Health, he gave up acting and focused on a career at the cooperative. Over the next 2 decades, he rose through the ranks and gained the deep admiration and lasting respect of fellow employees.
He's a visionary. That's the very first word that comes to mind. That Phil always has a sense for the big picture. He always has a sense for what something can become, not just what it is today, but he's always stretching to try to find new ways to do things, to find ways to broaden horizons, to find ways to partner with other people that he may not even think might be potential partners, to develop something that's greater than one had thought possible.
I think during the course of the time that I got to work with Phil at the co-op, lots of big things, both locally, nationally, and thanks to timing, I was at a great place, a wonderful organization, and a leader that had no fear.
I think this is a man with a phenomenal amount of enthusiasm, compassion, dedication to providing health care and bringing the best research that we have to the American people. Now, I think if you gave Phil a challenge of conquer the world in these same areas, he would take that on. He's got tremendous amount of vision. He has probably the most incredible amount of energy for let's just go do it or let's just go try it of anybody I've ever known.
And the thing that I remember, the comments I remember Phil would make when I would go into him with an idea, his response would be, let's try it. It would never be, well, I don't know about this, how about this, if you thought of this. He said, let's try it, so that his first interaction with you was supportive. And it might not work out, but at least you knew that he was in it with you. So I think it was as a mentor, as a supporter, as a guide, as just a really good boss.
One of the things that we don't talk about very much with people is their ability to do that, to open doors, to give people the encouragement, give people the freedom to grow. That's something you can't put on a resume and is not easy to quantitate, but I think a lot of us have felt this sort of silent hand of encouragement of Phil's over the years to do more than we might have otherwise done.
He has that, I think, an extraordinary talent for selecting good people and bring them into his organization. I don't know anybody who's equal on that either.
You know, what Phil's leadership stands out in his passion, absolute passion, and supportive of the people who do the work. I mean, Phil's the kind of guy who doesn't need the credit. You know, he really is there. He totally believed in Group Health's social mission. And everything he did in his leadership, whether it was working with the medical staff, with the consumers, or with management, had to do with advancing the mission of Group Health. So I think passion and commitment stand out to me as the two critical characteristics of his leadership. Yeah.
Those unique leadership qualities made Phil a natural choice to become CEO in 1991. Soon after, his wisdom was sought at the national level.
In the early 90s, Phil was extremely active on healthcare reform at the federal level. He must have gone back to D.C. once or twice a week for at least a 2-year period. First, he became very close with a man named Ira Magaziner, who was President Clinton's person to really manage the healthcare reform process. And Phil was clearly the most respected person among group health practices in the United States. And he was called upon by Magaziner to go before Congress, to be with Hillary Clinton, to be with the president on those kind of issues. So whenever you saw something coming out of this National Commission on group practice on HMOs, it was usually Phil that had written it or had been a major part of that.
When Phil became chair, and it was just around the time he was serving on the President's Commission on Healthcare, that he came here and was quite serious and quite strong about the need. We thought we were very successful at the time, the need to change everything, and the need to really be focused on what contributions our plans are making, and creating innovative partnerships and doing things differently. And we've done that. It was hard. It was very hard at first, and we owe that to Phil Noodleman for challenging us and telling us that we could be better.
There must have been at least 2 Phils in the early 90s. He was consulting in D.C., managing at GHC, and continuing to devote time and effort to the local community.
I've known, it seems like, Phil for almost all my political career. And what I remember most is him being a visionary, a civic leader. His passion for having a world-class zoo and getting the funding was just phenomenal.
Phil has that combination of both caring about our overall effect and our responsibilities within the community, and having the capabilities by which to be a meaningful part of the answers.
And he has a very strong personal drive to contribute. You see it in his work with the zoo, with other areas, and you see it an awful lot in healthcare. That it's really been a part of his career that it's important to him to do something that matters for people.
Well, certainly the desire to pay back to society and be part of the community in which we live, I think that stands as a mountain peak in his whole profile.
He always reminded us, those of us who worked for him, that we had a responsibility and a role for the health of the broader community, not just group health. He focused on group health, but not to the exclusion of the public's health, and particularly those people who might be left out, the poor, the homeless, chronically ill, and people like that.
I think that if you look back over the ways that he's contributed, you're going to see patterns where he's been involved in boards that served underprivileged kids. He's been involved in setting up institutions that, not for-profit institutions and foundations that have an educational focus. In his days as a pharmacist, he was interested in drug prevention programs for kids. You see his leadership at the national health policy level. You see his state work at bringing immunizations to children across our state. You see his involvement in boards in new technology companies, trying again to translate what we know from research into something that can benefit mankind. You see him on boards of national organizations that can influence the future of healthcare research and healthcare delivery in our country. So the pattern I think that you see there is an underlying commitment to advancing the human condition and creating resources and community coalitions that will do that.
What I notice is, again, how much he cares about uniting and bringing people together. And I think the sculpture that's in the entrance of this building, the hands uniting, united hands, put there by Phil and Sandra, is such a good example of frankly what I think of Phil Noodleman.
You can talk diversity, but if staff don't see you living it, it doesn't work. And I think what people got from Phil, very clear, is that he absolutely was committed to and believed in diversity, not racial, ethnic, geographic, the whole continuum. And you could see that in the results of his work. He didn't just say, we'll mouth the words. He absolutely believed in it. And you could see that in group health during the time he was CEO.
Not the least of Phil's many accomplishments can be found here, in an organization filled with people he inspired. People who will continue to uphold his high values, will continue to pursue his vision for the future. And as for his future, friends wish he would slow down, but they know he won't. Mostly, they all wish him the chance to continue doing what he does best.
I guess if I would wish anything, it's the opportunity to continue to be meaningfully involved in things, to continue to enjoy a great marriage and a continuing relationship with children and grandchildren, but also the chance to work and do things that make a difference, because that's what he cares most about. I think that's been a great gift to all of us.